Are you suffering with IBS, or could it be something else? What other conditions share symptoms of IBS, and how do we rule them out? As a consultant gastroenterologist, I know IBS symptoms can be similar to those of various other gastrointestinal disorders, which can make it tricky to diagnose. In this video, I'll discuss the different conditions that can be mistaken for IBS and look at how we diagnose or rule these out before coming to the conclusion of IBS. I'm Richard Sarsam, consultant gastroenterologist at Princess Margaret Hospital and Circle Reading Hospital, part of Circle Health Group. I have more than 20 years experience in gastroenterology and have seen thousands of individuals who are dealing with the gastrointestinal symptoms we associate with IBS. So if you are experiencing pain, bloating or bowel problems, but aren't sure what's causing these, I'm here to talk you through what to look out for, explain what other conditions that may be mistaken for IBS, and explain how I would go about making a diagnosis. So let's get into it. First things first, what is IBS? IBS stands for irritable bowel syndrome, which really is exactly what it sounds like. Your bowel is irritable. It complains a lot. And commonly the symptoms are pain, which is typically a crampy type pain. You'll feel bloated, and you'll have either constipation or diarrhea. Some people find they cycle between the two, so periods of constipation and periods of diarrhea. IBS is a common condition of unknown cause. It is also a chronic condition. So it is a bowel disorder that you are likely to have for your whole life. There are lots of medications and lifestyle changes that you can make to try and manage the symptoms of IBS. And many people find they can really reduce their bowel problems in this way. If someone comes to me presenting with these symptoms, IBS is definitely one of the first things that comes to mind. However, all these symptoms can have various other causes. So if someone comes to me with pain, bloating, and bowel problems, there are other things that need to be ruled out first. There are several conditions I typically check for first, and I'll talk you through each one now. Inflammatory bowel disease. This includes Crohn's disease and ulcerative colitis. Crohn's disease is a chronic inflammatory condition that affects various parts of the digestive system, causing multiple symptoms, including abdominal pain, bloating, changes in bowel habit, and sometimes weight loss. While there is currently no cure for Crohn's disease, early diagnosis and prompt treatment can make it much easier to live with the condition. And while this is a lifelong condition, you can have periods of good health, known as remission, as well as other times where your symptoms flare up, known as a relapse. While Crohn's disease affects people of all ages, the symptoms most often start in childhood or adolescence. Ulcerative colitis. This is the other form of inflammatory bowel disease, a chronic condition that causes the colon and rectum to become inflamed. Small ulcers develop in the lining of the colon, and like Crohn's disease, this is a lifelong condition which has periods of remission and relapse. Both conditions can have similar symptoms, and as I've said, these overlap with IBS symptoms. Inflammatory bowel disease is often associated with a raised fecal level of a protein called fecal calprotectin. If the fecal calprotectin is elevated, you may need to have a test called colonoscopy to diagnose this condition. The next condition is celiac disease. This is also called gluten intolerance. This is an autoimmune disease where your body reacts to gluten, a protein found in wheat, rye, and barley. We can test for it with a simple blood test called TTG antibody. If you do have celiac disease, you will need to stringently avoid foods containing gluten. When an individual with celiac disease eats gluten, their body attacks their small intestine, thus damaging the villi, which are small finger-like structures that line the small intestine. These villi are vital for absorption of important nutrients essential for the body health. In female patients presenting with lower abdominal pain and bloating, gynecological causes may need to be ruled out. These include endometriosis and ovarian cysts. If your consultant suspects you might have endometriosis or an ovarian cyst, they will most likely arrange an ultrasound or MRI scan which can confirm this diagnosis. Bowel cancer. This is the final condition with symptoms overlapping with IBS. Bowel cancer, also known as colon cancer or cancer of the large bowel and rectum. This type of cancer affects your bowel function, and so you'll often see symptoms like abdominal pain, cramping, bloating, diarrhea, and constipation. But bowel cancer has many other symptoms that don't cross over with IBS. For example, bowel cancer can cause rectal bleeding, anemia, pale skin, fatigue, and unintentional weight loss. Bowel cancer, of course, is a really important condition to rule out. And if we feel you have symptoms that point to bowel cancer, we will arrange a colonoscopy test to confirm or rule it out. So when should I see a specialist about IBS symptoms? If you're experiencing any uncomfortable or particularly painful symptoms, it is always a good idea to go and seek advice from a healthcare professional, especially if you feel your symptoms are not improving. Speak to your GP or arrange a consultation with a gastroenterologist like myself. The sooner you can get a diagnosis, the sooner you can get back on track, whether through a specific treatment or an ongoing plan to help manage your symptoms. A diagnosis is also great for peace of mind, ruling out more serious problems or identifying ones that need treating right away. So there you have it. These are the conditions that share symptoms with IBS, and how myself and other gastroenterologists answer the question, is it IBS or is it something else? Thank you for watching this video, and if you feel like there's anything that we didn't cover, or if you've got any follow-up questions about IBS or want to see us make videos on any other topic, then leave any questions or suggestions in the comment section below. If you would like to arrange a consultation to discuss IBS, bowel symptoms, or any other gastrointestinal symptom with me or another consultant at your local Circle hospital, then you can book an appointment at circlehealthgroup.co.uk or by clicking on the link in the description below.